My mom said I came out of the womb wanting to be a doctor and she didn't know where it came from. I had an operation game and they'd have to take the batteries out at night because I'd go under the covers and be like, I gotta get the funny bone in. It was just like always in my essence.
I went into healthcare to try to be of service in partnership with people and their families and their healthcare workers. Care that cares for the whole child and cares for the whole family around that child. Not just their illness, not just what's happening to them, but who they are as a person, which would help them to do the thing we all hope for, which is to thrive in the world.
The few of us that were here still remember the first COVID patient we intubated, knowing their decline was inevitable. It was fearful. I mean, I just remember coming to grips with it one day at home, like, I'm probably gonna die.
Hospitals still have 6 feet apart stickers that are worn and faded away on the ground, and sometimes it feels like, are we creating healthcare workers that are worn and faded down to the ground too?
They might have gone out and banged their pots and pans at 8 p.m., which I'll tell you, I still, to this day, remember the feeling. We would walk out the ambulance bay to listen to these apartments surrounding the ER banging on it, because it made us feel like somebody gave a shit about us. Sadly, I've had 3 colleagues who have committed suicide and far more that just quit because the price is too great. And I just thought, for me, I would stay and figure out a way to get myself back and help others, but it wasn't like some noble thing. It was just, it worked for me. Now I'd say what influences a little bit more of the day-to-day is that there are politics that have impacted policies in healthcare, and there's a feel in the country of how divided we are, and it trickles right down into medicine. Taking people off of ACA, Medicaid, state programs, that's going to cause more problems. We will see them here.
People who are very, very vulnerable and in need are having all systems of support dismantled around them.
I think as providers, we always fear that the innate imperfections of being a human will lead us to make a mistake that harms a patient. Not, are you going to be persecuted for practicing within the guides of accepted medical treatment? That type of persecution, I don't think ever crossed my mind. I've had colleagues who have been doxxed because they do gender-affirming care. Multiple colleagues have had death threats to their family because they care for different marginalized populations.
I'll have patients get in arguments with me about, I don't believe in that science or your science. I'm like, it's not mine. You don't get to select which science you want to believe in. There's so many uninsured. There's some immigrant populations that are struggling to even get access. So it all trickles into us as the dumping ground of, you take care of everything.
Let's say I'm a part of caring for somebody whose child is moving through cancer treatment, and yet now they're experiencing increased levels of food insecurity, housing insecurity, fear for their safety, fear for their well-being of their families outside of the hospital, fear for unknown medical costs.
It's painful
to see patients that we are trained to care for not be able to access the care that they need, to be worried about whether they're going to remain having health insurance coverage. So many of us go into healthcare because we care about people. And it hurts when you can't do what you're trained to do. They're inserting themselves in what many of us would consider a sacred space.
The worst thing I personally see is the closure of rural ERs because of funding issues. Those communities are now having to spend a couple of hours to just go get basic health care.
My biggest fear right now is for the unneeded pain and suffering and loss that our patients and their families will experience first and foremost. The avoidable, unnecessary, unneeded pain.
A lot of people go into nursing because there still is the undercurrent of it's a noble profession. One of the purposes of life, to me, is you help other people.
We care for everybody who walks in those doors, regardless of who they are, how they identify in any way, shape, or form. We take care of people.
I personally refuse to accept anything other than supporting kids and families to the best of our ability as a community.